Hi, I'm Talli Rosenbaum, and I am hoping that you're able to see me and that you're able to hear me. Great. Okay. So I think we'll get started. I want to thank the Jewish Community Watch for inviting me to present today on the topic of sexual intimacy, healthy relationships, and healthy intimacy with a history of sexual abuse. Um, in this conversation, I plan to talk pretty directly and openly about two topics which are generally difficult to talk about. Healthy sexuality, which in itself is a topic that doesn't get spoken enough about in a frank and open way. And of course, the topic of sexual abuse, which is also a difficult one to talk about. Um, I'm only seeing myself and a screen. I know that there are listeners who are tuned in. I can't see you. I can't see how you may be reacting to what I'm saying. And so I'm going to ask you to be really aware of what you're feeling as you hear me and hear the information that I present. Some of the stuff that comes up from this talk could be triggering. Be aware of your sensations, ground yourselves. This is going to be recorded, so it's live right now. But if you need to take a break, you can listen later. I'm going to start by introducing myself. My name is Talli Rosenbaum. I am a sex therapist. I'm a couples therapist and an individual therapist. And one of the reasons that I was happy to um, answer to the JCW's request to give this talk is because as a sex therapist and also as an individual therapist and somebody who does deal with trauma, I found that there seemed to be a kind of disconnect between therapy that addresses uh, abuse or addresses trauma and therapy that addresses healthy sexuality. And what we know from the research is that uh, people who have been sexually abused do present with a high rate of difficulties in their sexual functioning and in their sexual lives, as well as in relationships. But people often do go to sex therapy for treatment. Um, and what I have found in my practice, and what research has also shown, is that people who have a history of abuse don't generally do well with standard sex therapy techniques. In fact, those techniques may trigger, just like sex itself can be triggering. Going to sex therapy can be in itself triggering. Some of the techniques don't work well for people with a history of abuse. Um, the problem is that often people come to sex therapy or relationship therapy, looking to address um, their difficulties in a sexual relationship without necessarily connecting those difficulties to a history of abuse. So I think we can start off by acknowledging that sex abuse takes many forms, and there are many different variables to how sex abuse is experienced. And there are no rules about what type of abuse is going to lead to what type of sexual problem, or if it is going to at all. Um, what we do know is that there can be abuse without necessarily touch. There could be violent episodes that have been perpetrated by a stranger. There can be family and incest abuse, which is done in a gentler way. And there can be multiple abuses, whereas there can also be like one thing that happened one time. These are all variables that can define the type of abuse. Um, and some research has looked at what risk factors are related to having sexual problems. Risk factors such as whether or not there's penetration, whether or not it's the father who abused, those seem to be at higher risk. But I don't really want to cite too many statistics in this presentation. I think that it's important to be aware that any sort of abuse or any sort of trauma can definitely affect not only individuals, but it affects their social surroundings, and it certainly affects their intimate relationships. Now, it's also important to recognize that it's not just about the abuse itself or what happened, it's about the context in which it happened. And sometimes the trauma is not only what happened, but wasn't dealt with, or how it was dealt with, the way in which it was dealt with. Um, was the was the person who experienced the abuse, did they reveal it? And if they did reveal it, were they shamed by it? Um, and so, did they report? Did they not report? And why didn't they report? And sometimes not reporting has a lot to do with a lack of self worth, or feelings that this isn't really that big a deal, this isn't really that important, or feelings of guilt and shame. This is really my fault. I caused this. And so we have so many different ways that people experience abuse, and we have so many different ways that people um, are resilient and are able to survive abuse. And what's important is being aware of how one's life and one's way of being in life is affected by abuse. Um, Abuse can affect the way people form relationships, the way they deal with adversity, the way they cope with everyday problems, how people relate to their children, to their peers, how they relate to their own health, and how they live their lives in a joyful way. What we also know about having been abused or having some sort of sexual violence, um, molestation, uh, it is associated with traumatic types of symptoms. What happens is that in an abuse situation, it triggers our stress response, our fight or flight response, and sometimes there's a fight and sometimes there's a flight, but most of the time there is just a freeze. One is unable to escape. One is kind of like the deer in the headlights, shocked. Many people will describe a kind of a freeze dissociation in order to survive. And so, what happens in a post-traumatic situation is that um, people can experience those same symptoms, those same feelings of being frozen or being terrified or being horrified, um, even when the danger is no longer taking place. And in very extreme cases, one can come out with full out post traumatic stress disorder. In order to be diagnosed with post traumatic stress disorder, there needs to be several specific symptoms that include intrusive symptoms, flashbacks, nightmares, intrusive memories, reactions to triggers. Another description of PTSD would be avoidance and numbing symptoms, and symptoms that are described by avoidance of reminders, avoidance of thinking about the event, trying to avoid. And certainly sexual avoidance in a relationship would be one way of dealing with the triggers involved in what sex brings up for people who have had negative and abusive and painful and traumatic sexual experiences. Negative cognitions and moods are associated with trauma as well. And for many people, there is a general hyperarousal, an inability to relax, hypervigilance, irritability, insomnia, difficulty sleeping. So when we talk about how sexual abuse can affect relationships, we're first talking about how all trauma can affect relationships. Because when we emerge from a trauma, where we emerge dysregulated, it's very difficult to regulate our emotions. And so having post-traumatic stress will affect how people relate in their most intimate relationships, because there sometimes is a preference for isolation, for not having to deal with another person, to go kind of into your own isolated space. It's very difficult to share. It's difficult to share feelings. It's difficult to talk about what happened, and many people repress those memories and don't necessarily share. Um, People in relationships, when they have experienced trauma and they're experiencing post trauma, they have a fear of their own anger, their high risk behaviors. It's hard for trauma survivors to share their feelings. And very often, spouses of trauma survivors have symptoms as well. So, sexual abuse affects the forming of relationships. It affects how people view themselves and how they experience the world. Women and men with a history of sexual abuse often experience difficulties in forming relationships. And these relationships can be challenged by emotional dysregulation, avoidance, intrusive symptoms, um, and also just checking out, not being there. Um, Now, sexuality, sexual function is really not just about sexual function. We're going to talk about specific sexual issues that can come up, but I'd like to talk about sexuality more as a part of the development of the self. We're sexual human beings, and how we develop the different skills of intimacy in a healthy way informs how we are going to interact. And if there's abuse or trauma, that's going to sabotage that natural, healthy development. So it's important to note that not all sexual abuse survivors will necessarily experience sexual problems. Many are able to compartmentalize, because it's not necessarily about the sex itself. It's very often about feeling uh, a lack of autonomy, feeling objectified, feeling like you don't have a choice, feeling like you don't have a voice. But um, there definitely, for many people, they can come out of sexual abuse with the ability to enjoy a healthy sexual relationship, because it's very clear to them that the context is completely different. But for many, there are many triggers in a healthy sexual relationship that bring them back. And because when you're in a trigger, you're kind of in the fight or flight, you're not always able to remind yourself, because you don't always have access to those higher brain centers, the prefrontal cortex that's logical and rational, and is telling you, that was then, but this is now. It's not always easy to self soothe and calm yourself that, in fact, you are not experiencing sex abuse right now. You're experiencing healthy sex. This is a journey, and it needs to be developed along with your partner. So there are a variety of factors as to why some people have sexual problems and why some don't. Um, it does have a lot to do with how the abuse is processed and remembered. But for the most part, abuse survivors do experience sexual problems at a higher rate than people who have not been abused. And this is important because many people who come to different types of sex therapy settings don't realize that the issues that they are having have anything to do with their history of abuse. So, for example, if a woman is coming to a doctor or a therapist because she just resumed a sexual relationship and she just began a sexual relationship and she has difficulty with vaginal penetration, it's painful. She may go to treat the problem without realizing that it has anything to do with the abuse because the abuse did not involve anything like that. But that's not how it works. The abuse involved feeling that your body was not yours and that you don't get to choose what you want to have happen. And so any sort of triggering of that same fear is going to impact. And so, people will go to sex therapy, for example, if not getting aroused. And what we know is that basic sex therapy techniques that are behavioral, they're often about psychoeducation. This is your body and this is how it works, and this is your clitoris, and here's a vibrator. You can learn how to give yourself pleasure. But for people who have been sexually abused, often doing that is extremely distressful. It doesn't feel good for them, that genital arousal. The genital arousal is wired in with all sorts of confusion and shame. And so it's not about physiologically improving arousal, it's really about um, treating the trauma. And that doesn't always sufficiently take place. Just like in trauma therapy, there isn't always sufficient attention paid to sexual functioning. So, really, the purpose of this talk is to kind of bring to uh, bring to the attention of both the survival community and the therapeutic community the importance of that bridge between trauma therapy and sex therapy, and how it really needs to be done um, in a in a in an integrated way. Um, Going to trauma therapy to EMDR or somatic experience, whatever, and then going to sex therapy to somebody else is actually um, it's actually perpetuating the split. People already feel dissociated and split in their parts as a result of the abuse. So, what we want to do is integrate our sexuality as we build um, the sense of self in the wake of abuse. So, before we go on, I'd like to talk more about the development of a healthy sexuality and sexual functioning. But first, I want to take a moment to acknowledge the cultural context. I even had a few questions that came earlier, and even those questions very much point to how specifically Jewish culture and Orthodox Jewish culture can be particularly important in how abuse is experienced and perpetuated. For example, being in a culture where sex is something that is not talked about, not healthy sex, and often it is considered to be too shaming and too embarrassing to talk about the abuse that happened. And so many young people who unfortunately experience child sexual abuse don't have a language to tell, and are way too embarrassed to talk about it because they can't even talk about their body parts. It's too embarrassing. So what happens is that there's often um, these kind of horrible things that happen, and then they're put away, and sometimes they happen more than once, because once you've been abused once, you do carry the feeling of being damaged goods, and you lose your ability to develop your sense of self, your right to autonomy, your entitlement to boundaries and to saying no. And this can then lead to um, re re-triggering of abuse, particularly upon marriage. And so, in a cultural context, when there is an expectation to get married and have sex on your wedding night, or an expectation to have sex on mikvah night, or um, rules about having sex uh, that don't really relate to the possibility that this might be an extremely triggering expectation, it will actually reenact the abuse if you feel that you have to do something with your body that you are not ready for. Um, this can really make the beginning of the marriage a very explosive place. And this is true for men as well as women. Very often, the beginning of a marriage is when the memories of the abuse begin to emerge, and couples don't often, they reveal the abuse to one another. They did not reveal it previously, and so the couple needs to organize around that. um, I also want to say that even in situations where there has not been any history of past abuse, I have worked with many couples where there was a feeling of abuse from just getting married, and from trying to have sex and not succeeding to have sex, and feeling like uh, they have to, even though it doesn't feel good or they're not functioning. So sometimes it's the culture itself that can act as a perpetrator. Um, and so I'll read you the couple of questions that I did get, and I just kind of stuck them in here. So somebody asks, how does halacha view the trauma aspect? Are halacha meaning Jewish law? Are there heterim, which means are there compensations or are there allowances for sexual activity that is not straightforward penis and vagina sex, when that action may be re-traumatizing to victims? And what are the obligations of sex between husband and wife when one of the partners find it triggering? So I think questions like this really speak to the kind of place of missing the point of what sexual recovery is all about. Sexual recovery is about never having to do anything with your body that you don't choose to do. And so, I could get calls from a college teacher that'll say, this Kala of mine, she's getting married. What do we do to make it easier? What lubricant? She was sexually abused. Do you have a lubricant that she can use, or do you have a drug that she can take to make it easier for her? And that it boggles the mind, really, because nobody should have to reenact their feelings of lack of autonomy. And so clearly, um, bodily autonomy, communication with your partner, each person knowing that they need to be able to establish and be in a safe, containing, loving environment is going to be really, really important. So I can't answer the questions that are rabbinic questions, but my experience is that when you work with rabbis who are very familiar with this, certainly our I'd like to believe that our tradition is a humane one, and that for sure there are situations where, of course, you don't have intercourse when intercourse is either triggering or painful, um, and until you're ready, absolutely. And being ready is part of the journey. So, what I want to do is just spend a couple minutes talking about the development of healthy sexuality, and a little bit of how sex works and how sex abuse can derail healthy sex and what to do about it. So, in the development of the self, we develop a healthy sense of self, a healthy body image. The self is part of the sexual development is um, being comfortable with our gender, having a language to express emotions, having our emotions validated, acknowledging what feels good, what smells good, what tastes good, and also knowing that you can put boundaries. If you don't want to hug your aunt, you don't have to hug your aunt. And also having healthy and secure attachments, but also when you want to kind of try out your autonomy, you get to do that, but also run back to your mother for safety when that's necessary. And so we develop kind of a relationship with ourselves, and at the same time, we develop intimacy with other. And intimacy with other begins at a very young age. It's about developing friendships. Touching, hugging, sharing feelings, showing and receiving empathy. You can see this in really little kids. Um, Learning how to be compassionate, and also learning how to trust. When you tell your friend a secret and your friend keeps your secret, it develops this kind of sense of safety in the world, that you can trust another person. You can be heard, you can be understood, and you also get to be assertive when you need. All part of healthy development. So, what about physical intimacy? Well, in order to feel comfortable and safe with physical touch and sexual touch, um, it's really about kind of a balance between feeling safe enough to expose yourself, expose your body, expose the sounds that you make when you're feeling aroused, but also to take those risks at the same time. And so you want to be able to connect to yourself, connect to your senses, and connect to the partner that you are interacting with. And it requires the ability to relax, the ability to let go, and the ability to get aroused and feel good and comfortable being aroused. So when I talk about understanding sexuality, I like to talk about the biopsychosocial model of sexual functioning, which is that there are many different things that kind of need to happen from a biological level, from a psychological level, and also socially, relationally, and culturally. But when we look at the specific variables of sexual functioning, we're talking about sexual desire, um, arousal, um, orgasm or ejaculation in men, and often the kinds of sexual difficulties that occur have to do with lack of desire, difficulty with arousal. In men, they may not be able to maintain an erection, they may not be able to ejaculate, or they may ejaculate very quickly. Women may experience um, difficulties in arousal, difficulty having orgasm. They may actually also, and this may happen to men as well, begin to experience arousal. And as the heart rate increases, as the arousal itself um, is being experienced, this triggers nightmares, flashbacks. Um, the arousal itself can be a trigger because, first of all, it's arousing and that's triggering. Um, and that's where a lot of the avoidance can come in. So, lack of desire is not always really about lacking desire. It's not about lacking libido. It's not about not wanting to connect. It's really about avoiding having sex. It's sometimes avoiding any sort of physical activity that even the survivor wants. The survivor may really want intimacy, cuddling, but will avoid it because of their fear that it will turn into sex. And even saying, I'm afraid it's going to turn into sex is a way of experiencing sex as something that you don't get to control. So let's kind of move on. Um, a lot of the cognitions or thoughts that abuse survivors have is that sex is an obligation, and it can be experienced with negative feelings, anger, disgust, guilt, um, difficulty being aroused, feeling emotionally distant, sometimes completely going into a disassociative state, um, being emotionally numb, not present, um, vaginal pain, vaginismus, difficulties with orgasm, erectile dysfunction, as I said. There's also problematic sexual behavior that can occur that actually even reenacts the abuse. People can come out of abuse with intrusive or disturbing sexual thoughts or fantasies, compulsive or inappropriate behavior. They reenact abuse because it's like the only way that they can get love or attention. They feel like objects without choices. Pregnancy rates of unwanted pregnancies are higher in women who have been sexually abused. There's a belief, there are these negative um, and maladaptive cognitions, thoughts. I'm not allowed to say no. Um, and there is a higher occurrence of follow up trauma. So, some additional possible mechanisms for having sexual problems in the wake of sexual abuse is that there are a lot of negative associations with sex. And not a lot of positive associations with sex. Your sexual experiences were negative, and it's again very difficult um, to separate. There is um, a lot of activation. As we said before, the sympathetic nervous system becomes aroused, and that arousal can be very overwhelming, that feeling of being out of control. And so people want to be able to avoid that. Body image and self esteem, but also body esteem, how you feel about your body, how you treat your body. Many people hate their bodies. It's their bodies that they blame for having this happen to them. They're disassociated from their bodies. And then, of course, there's the ongoing feelings of shame and guilt because they never had a voice telling them that this was not your fault. Nothing about what happened was your fault. Um, women with histories um, of child sex abuse, as I said before, they do show a lower response to standardized sex therapy treatments than non abused women. And this is because the reasons for the sexual issues are not necessarily the same. They're really about avoidance because it is so difficult to re experience those sensations. What we want to be able to do is find the way for, sorry, we want to be able to find a way to heal, not only to heal sexual abuse, but to go on a journey to sexual healing and be able to experience healthy, intimate, and sexual relations. So, how do we do that? Let me take a few minutes to talk about that before we go on to questions. So, first of all, it's really important to be aware, being aware of what happened, being aware of the triggers that um, interfere with what's happening now. Mindfulness seems to be a method that people who have experienced sexual abuse really do relate to, as opposed to other more exposing methods. Um, so, understanding more about how the abuse affected you, and there are so many different types of abuse. Um, Understanding the confusion around how your body may have gotten aroused, and how that wiring is a result of the abuse and not necessarily defining of who you are or what you respond to. Recognizing the guilt and shame, being able to answer the kinds of maladaptive thoughts like it was no big deal, but my body responded, so it was my fault. Those feelings, those thoughts are a result of your abuser's, um, you know, uh, ways of making you feel that it was your fault. You made me do this, you're so beautiful, and all those um, awful things that the abusers say. So, one of the questions that I did receive was how to deal with flashbacks during sex. So, I'm going to talk about um, how to go about dealing not only with flashbacks, but dealing with all of the negative kinds of sensations around sex. But first, what we need to do is acknowledge the impact of sex abuse on sex. And that's not so simple because, the not telling about abuse was a very big part of many people who were abused, of many people's lives. They've carried around the secret of their abuse for a very long time. And all of a sudden, we're talking about it. And that's very new. And so we need to acknowledge that. Identifying the impact on sex, the triggers during sex. Um, I was working with a woman who would talk, who came in, and there was no identification of abuse in the beginning. And I have to say too that, a lot of times in therapy, abuse disclosure really happens later, once the relationship is safer. So this particular woman who came in, she did a lot of this, ugh, and she would talk about how her husband touched her. She'd go, ugh, and that would be like a lot. And of course, I asked her if anything happened, and she said no. But then after about 6 months of therapy, we did talk about the things that she had sort of didn't realize that were such a big deal. But they were a really big deal. And when she was able to describe how, when she was about 10 years old, a family friend kissed her full on the lips, um, she had that same reaction. Ugh. And it was really a very sensory reaction. So many times the whole conversation is not happening here. It's a completely visceral sensory experience that gets transferred. And so there isn't always a conscious awareness of it until we go deeper into the work. So that kind of sensory reactivity is common. Dissociating during sex, having anxious reactions, where the muscles of the pelvic floor will actually tighten up in response to attempted penetration. And this is really the body's way of saying no. And it happens a lot when there isn't a verbal way to say, no, I'm not ready. Often there's an inability to stay aroused or to reach orgasm. And we also need to understand here, too, how there are cultural contributors to feelings of disgust around sexuality that are not necessarily related to abuse. I have many, many male clients who talk about feelings of disgust around masturbation if they were caught masturbating, or the way that masturbation was talked about as something disgusting. Those those connections are created. Um, so one way to begin the healing journey, after acknowledging the impact, is to learn about healthy sexuality, to learn to distinguish the abusive type of sex from healthy sex. Healthy sexuality is very different. It is a choice. It is characterized by choice. It is characterized by consent, equality, respect, being able to stop at any time, honesty, being authentic and genuine, trust, safety, intimacy, and sensual enjoyment. These are all extremely important. So make sure that you don't re-trigger yourself in the books that you read and the movies that you watch. You want to decrease your exposure to abusive sex images and increase your exposure to examples of sex that take place in which partners are caring and loving towards each other. You want to create new meaning. Post-sex abuse ideas are that sex is uncontrollable, that I always have to say yes, that sex is something that you have to give in exchange for love, or that sex hurts, or that sex is a secret, as opposed to healthy ideas, which are that sex is a natural drive. It has a powerful healing energy. It's a part of life. It's conscious. It's responsible. It's an expression of love. And it's done with mutual desire and, of course, consent. Another aspect is to be aware of the sensations and learn how to handle those reactions. It's the autonomic nervous system at work. They're automatic reactions, and sometimes you need to be able to, experience them. You can experience an unwanted reaction to touch that you don't really, you want the touch, you don't really want to react that way. So you can learn to be consciously aware to calm yourself physically with breathing, self massage, relaxation techniques. And then when you're ready, you can affirm your present reality, reminding yourself that, this is who you are now. You're with somebody that you love and that you have many options. Of course, you want to be able to modify your sexual activity, alter it so that it doesn't feel triggering. Do things differently than what was done. And the more that you become aware of your triggers, the more you will gain control. And be aware too that your partner should be um, a, a partner with you on the journey. I do want to take a minute to give a shout out to this book called The Sexual Healing Journey by Wendy Maltz. I think it's a fantastic resource for sex abuse survivors to help them on their journey. I welcome questions. I think that there should be a chat box and questions should be coming up. Maybe one of you can write something just that I can make sure that I'm seeing what I'm supposed to be seeing. I would like to answer a question that was emailed to me about pregnancy and childbirth, which isn't directly related to the topic, but I think it's important to answer. In fact, there are quite a few studies about how the rates of adverse types of events in childbirth are higher among survivors. Um, Giving birth can be very, very triggering. There's issues of control, expectations, what's going to happen, and very often childbirth can be experienced with helplessness, powerlessness, with a loss of control, with feelings of anxiety, an inability to trust, and it can be re-traumatizing. It's a very vulnerable experience, and it can re-trigger even just the exams during pregnancy, going for an ultrasound and having the ultrasound gel put on your abdomen. That ultrasound gel, the feeling of it can remind victims of the abuse that they suffered, and procedures can be painful. The need to disrobe, the need to depend on authority figures and to trust them. So I do want to say that there has been a move towards trauma informed healthcare, and you should choose providers who are trauma informed. I teach trauma informed physical therapy to physical therapists, especially those who are involved in treating sexual problems like vaginal pain. And so, if you are seeking treatment for any kind of sexual issue, then it would be a good idea to seek a physical therapist who has specific training in working with trauma, and also childbirth informed, trauma informed childbirth staff. I just got a note here that When Survivors Give Birth by Penny Simkin is an excellent book. Penny Simkin really is an amazing resource, and her 1992 study on pregnancy and childbirth and vulnerability of child sexual abuse survivors during pregnancy and childbirth is a very valuable resource as well. So thank you for that. Okay, so we are coming up on about 45 minutes, and I do know that my chat box is working, so I'm just going to take a quick drink of water and give you all a few minutes to collect your thoughts or questions or whatever questions you have. Okay. Okay. So I know that a lot of people signed up, and not everybody is going to be able to hear this live. So, for those of you who are listening live, I do want to thank you very much for tuning in. And I want to also thank those of you who will be listening later. And I really just want to, okay, I just got another question. How to normalize to myself that when I feel attracted to somebody, that I'm okay, and not to automatically have a sense of doom and dread, that these are normal God given reactions and that I'm okay. I think that's an excellent question. So, what we're talking about here is an automatic reaction. And so, because in the past, feelings of excitement or feelings of attraction or any kind of sexual awareness has been so um, painful and confusing and steeped in shame, the ability to relearn new ways of looking at your sexuality as normal and as good requires kinds of two levels. There is the sensory awareness of that immediate um, fight or flight response. And then there's the ability to calm that and access the cognitive mind, which goes offline when you're in that fight or flight response. And so being able to calm yourself and going back and saying, no, wait, you know, I can experience arousal in a healthy way. And part of the process of healing has to do with allowing yourself to experience arousal, whether it be through, taking long bubble baths or self stimulating, doing it with permission, knowing that this is your body and you're choosing it. And that's what makes it fine. And then moving from that into a coupled setting. Okay, now a lot of questions are coming in. So um, I believe that I believe that God keeps score of my sexual pleasure and that I'm not meant to enjoy. It doesn't feel safe. So I control my emotions before enduring. Well, I think that that's an exact example of, the maladaptive thinking that we develop. And we develop these feelings in order to survive. And I think that what we don't want to do is we don't want to say, don't think that way. This kind of thinking has allowed you to survive. Um, but I think that what we want to understand is that this way of thinking emerged from what was done to you, and that part of healing from what was done to you was to be able to empower yourself to take back the God given ability to experience pleasure. And that, I tell people that, for example, in women, there's only one function of the clitoris, which is an organ that women have that has no other function other than to provide pleasure. And why would God create women with a clitoris if not um, for appreciating the value of sexual pleasure? How do I know that God wants me to enjoy being sexual with my wife? I'm even afraid that I'll somehow be punished. Look, I think again that this is part of the spiritual abuse that sexual abuse um, brings with it. Believing that uh, believing that God does not want you to enjoy sex when in fact, we have uh, sort of a value of of sexuality in marriage as being sacred, as being a place where two people connect um, and procreate and provide mutual pleasure and satisfaction to each other. It's really part um, of our values, and also part of, the mitzvah of ona is really about providing pleasure. And so, it's really about understanding that the ambivalence, how do I know God wants me to enjoy? It's really understanding that that ambivalence is really the result of those negative experiences. Okay, asking for a significant other. If because of the abuse, the body has a high tolerance for pain, goes numb, and rough sex is what the body wants, or now that's the only way to feel pleasure, how can one change that? Okay, that's an interesting and complex question. Um, and it's something that I can't really answer this way because I would have to ask more questions about the experience of needing rough sex. Um, Rough sex is, it's a thing that people do. It's not necessarily a result of abuse, and it's not necessarily a bad thing. But if it's the only way, and if it feels bad, if it feels disconnected, then we that's what therapy does. It rewires the body to be able to experience pleasure in a gentle way. It's just those those sensory connections get lost, and it's just too overwhelming to be able to tolerate this very gentle, soft, slow, light sensation. And so there's almost a need to kind of overwhelm the system in a very kind of almost painful way. Pain and pleasure neurologically are on similar tracks, and so we don't often have the ability um, to to separate it for some people. But that's part of the work. And again, if that's okay, if it whatever works, if it works for you, if it works for your partner, and you don't have stress with it, that may not necessarily even be a bad thing. But that's part of the couples therapy. Would be to determine we're dealing with two people, and whenever you're dealing with sexuality and two people, you have people who respond differently to different things, and so that's part of the work, is kind of being able to negotiate healthy sexuality for both partners. I hope that answered that sufficiently. Okay, so I want to thank you all for your. I'm just going to wait like 1 second to see if there's any more questions, but I think we're good. Um, Please feel free to email me, Talli at tallirosenbaum.com. There are two L's. I have a website as well that you're invited to um, uh, visit. Um, and I also want to invite you to listen to a podcast about healthy sexuality in Judaism. It's called Intimate Judaism. It's a podcast that I do with Rabbi Scott Kahn. Um, Thank you for this question. It was a question that was sent previously, and I forgot to answer it. Is it possible to have a healthy sexual relationship after years of childhood rape? Years of childhood rape is devastating. There's no question. And there is no question that it is very challenging to be able to heal from something like that. But the answer is yes, it is absolutely possible with the right therapy and the right partner and the right journey. Um, Everybody should be able to reclaim their entitlement to a healthy and satisfying sexual and intimate life. And if you take one thing from today, it's the hope that there is help out there. Many people who have gone through a journey of healing from abuse did not necessarily talk about sex, healthy sex, with their therapists. And so you may not be done with your journey. There may be a missing piece. And so, keep going in your journey so that you can experience intimacy, both emotionally and physically, in a positive way, in a loving way, in a connecting way, and so that you can live a meaningful and satisfying intimate life. Thanks again. I appreciate your listening, and I would like to wish continued healing for everybody. Thank you.